So cupping is very good for general aches and pains because it is increasing the local circulation in the area where you're working. So by doing so, again, it's bringing more fresh blood to the area, but it's also releasing any old, stuck body fluids, blood, scar tissue. You know, all of these things can really restrict the movement in a part of the body and create pain. Also, especially with elderly people and arthritic type conditions, when that circulation slows down, also it tends to get quite cold. So by using some moving cupping techniques, we're warming up the area and increasing that circulation, thereby reducing pain. When we talk about joint movement, by using cupping, and again, using some dynamic moving cupping techniques on those joints and maybe going through some range of motion, we're really breaking up adhesions and scar tissue and getting those joints just moving a little bit better. And generally speaking, when we have more mobility, we have less pain. The only case where this would maybe not be the case would be if there's ligament issues. So again, you know, it's about understanding the body and understanding the conditions. But one small caution in this would be a ligament tear or sprain, because if there's a second degree or a deep sprain of a ligament, we have to be careful because there's no elasticity in a ligament. So we want to make sure that we're not actually pulling that ligament even more, creating a greater laxity in the area. So it's always good if there is a more serious injury to make sure that that client has had the proper testing done to make sure that you understand what the underlying problem is that you're working with. Also, cupping can be very, very effective for swelling and edema. But again, we have to look at the source of the swelling and the edema. So for example, if we just have a simple kind of swelling in an area and we can see that is because of an injury, then we can work on cupping to get rid of that last bit of swelling and edema in the area. However, if we look at a client and they have a lot of edema or a lot of swelling, for example, around their ankles, then we may want to look a little bit deeper and find out why that edema exists. Because often pitted edema is a little bit more chronic condition and it may be coming from a deeper place. So we want to find out, does this client have hypertension? Does this client have diabetes? What's going on with them? Because even though the edema and the swelling may be indicated for cupping, the underlying condition that's causing the edema and the swelling may be a caution or a contraindication for that client.